If you have hip arthritis and you're headed for a hip replacement, or you just want to avoid it altogether, there's several mistakes that people unknowingly make that put them on the path for a bad surgery outcome and weakness for years to come. In just a second, I'll reveal what it is, and it's not what you think. Plus, I'll show you 3 exercises to get you walking smoother in days, not weeks. Most people with hip arthritis skip this exercise because it looks too simple. But the reason that you're walking so wonky is because your hip flexors are so weak. So we're gonna start with a sitting version and build from there. With a seat that's pretty high, if your seat doesn't go this high, just boost it up with some pillows. We wanna start with our hip down below that 90-degree position, and then we're just gonna work in the shortened range of the hip flexor. So when we bring this up and down, it's not doing a whole lot for you. You wanna lift up and hold. Now the key with this is to stay straight in your back, and I can feel it starting to kind of cramp up in my hip from being held in that shortened position. As soon as you lean back, this does nothing for you. If we wanna strengthen the hip flexor, stay straight. Try to hold that there for 5 seconds to start and build that up to 10-second holds. The higher that you go, the shorter you're making that muscle, and the more you're gonna build that strength at that upper range to allow that foot to come through clearly at different speeds and give you more of a smoother walk and less pain in your hip. If you've had a hip replacement, most people are terrified of doing hip flexion because your surgeon told you not to break 90 degrees to protect the replacement incision area. Now that's true, and you want to check with your surgeon to make sure that you're clear to do hip flexion, past 90 degrees especially, but until that point, you can work at 290 degrees and try to hold that for that 10-second range. Once you're cleared to go beyond that from your surgeon, you want to try to start to work that higher range of motion to build the strength. To make this hip flexion exercise more functional, you can stand. Again, try to keep your back as straight as possible. Avoid leaning backwards. You can use a table or a chair on the other side to keep you stable and lift that up just like you did from sitting, and try to hold that for 5 seconds initially, build up to 10. Once you can do that 10 seconds without difficulty, you try to go higher and higher and higher, building that hip flexor strength with the shortened muscle position. Start off with 3 sets of 5 repetitions and do it 3 times a week. Once you can do that without difficulty, go to 3 sets of 10 repetitions for 3 times a week. Now, if your leg feels heavy when you walk, it could be due to that hip flexor weakness. Bringing that leg through the range should feel much easier after just a couple of days of doing that hip flexion exercise. But where many people go wrong is that they don't strengthen that stance leg, and that would be the gluteus medius and gluteus maximus muscles. So this is where a lot of people have difficulty progressing their walking, and they have a lot of pain that goes into the joint because the surrounding muscles aren't supporting. So we need to focus on hip extension. Now the basic hip extension movement is just moving the hip backward. But just simply moving your hip backward, while it will contract and fire your glutes, is not how that muscle works in real life when we're walking and doing functional activities. The way it works is with your foot on the ground. That's when the glutes have to do most of their work. That's their time to shine. So the way we're gonna operate for this exercise is we're gonna stand on the one leg that we wanna work. Say it's my left. I'll stabilize with my hand on the table on the other side. And I'm going to kind of contract my glute here. And I'm going to try to lift my opposite side of my pelvis up. You can see from this angle here, hike this hip up and do that using your glutes on the standing side. You should feel that get fatigued and tired just after 3 or 4 reps, and you'll know you're doing it correctly. This hip hike move is targeting mainly your gluteus medius. Now we want to get into working the gluteus maximus, and the way we're going to do that is, again, standing on the leg we want to work, stabilize on the other side, and then we're going to reach back almost like a reverse lunge with the opposite leg, and you'll feel that turn on the gluteus maximus. You reach back, pause for a few seconds, and aim for 5 reps. This is going to hit both the medius and the maximus of your glute, and you try to maintain that stability without moving all around in your trunk. Now, I've had hundreds of patients who feel strong in therapy, but until we add this exercise, this tweak, they're not able to feel the carryover into their daily activities. Just a week or so of doing this tweak that I just showed you will get you over the hump. If your hip and your walking still feels unstable after this tweak, Don't worry, there's a balance hack that I'm going to get into next. Now, many people think their hip is weak, but it's actually their balance that is causing most of their unsteadiness and problems in their hip. The connection from our brain to our muscles is always giving us input about where our hip is in space, where our body is in space. So you can have good strength, but if you don't know how to control that movement, you're gonna have unsteadiness and a lot of times pain. So if we go back to that standing maneuver we were doing, and we do the lunge, and you find that it's very unsteady and you have trouble, what you want to do is try to push your big toe down into the ground. Think of your foot like a tripod. Your heel is one point of the tripod. Where your pinky toe comes into your foot and where your big toe comes into your foot are the other two parts of the tripod. So you have your heel, and then you have those 2 points, and then push that big toe down. You should feel your calf and your ankle muscles work more, and you should feel a lot more stable when you're in that position. Now, just like the hip flexion, if your surgeon has told you not to extend your hip too much, make sure you get clearance to do these exercises, work with your physical therapist if you're in PT, but reaching back further is going to increase activation of those muscles. And while I'm doing this, I'm pushing that big toe down of this standing leg throughout the motion so that I have maximum balance and stability. Now again, this backward reach isn't super functional. It's much better than doing a leg extension. When we walk, we go at a faster speed than that. So when you get really good at being able to hold that position for 30 seconds without losing your balance and the big toe pushing down, we're gonna add a leg swing back and forth at the rate that it would be when you walk, or if you wanna get back to jogging, you wanna move this leg at that same rate, and you're really gonna challenge that standing leg. You can even pump your arms like they would be when you're walking or running. You do about 10, 20, work up to 30 reps, switch sides, contract that muscle. The bigger range of motion that you move this swinging leg, the more you're gonna work that standing leg. Now, this is the mistake that most people make that keeps them in pain and not as functional as they'd like to be, longer than they should be. But it's not your fault. Most rehab programs don't even address it. A lot of times we're just focusing on strengthening and not putting all the pieces together into walking. The way to get the maximum gains for your hip arthritis or after a hip replacement is to put everything together into your walking so that your muscles are being trained throughout the day. Now, how are we gonna do that? Well, when you walk, you wanna make sure, number one, that when you strike the ground, you're hitting with your heel, and you'll feel when I just go back and forth, strike, put my weight onto my heel, you'll feel your glutes fire instantly. So when we place down there, we get glute contraction that should continue through the stance phase, we call it, through the leg swing. If you don't feel it contracting in the beginning, you can actively contract the muscle as you swing through and try to propel yourself forward. The other thing that happens when we're walking, we step forward and we put this foot down while this back leg is still flat. We're not getting any propulsion, we're not getting any forward push from our back leg, and then we just have to lean forward and we ride onto that hip socket. What we want to see in walking, hit with the heel and then drive forward. But really, before you hit with the heel, this back heel should come up in the air. So that push forward should happen first and then the heel strikes down. So what it should look like is I push up and forward, then that heel hits, I push, and then that heel hits. If you're only doing your rehab exercises and you're not retraining your walking, you're leaving half of your recovery on the table. Fix this and everything changes. To watch a video that helps with that push-off phase of walking, click here. Subscribe to my channel. For more pain-relieving tips for arthritis, click here.